everyone, and welcome back to episode 2 of Exotic Ward Conversations. My name is Sam, and I have the lovely Adam with me. We're going to be talking today about biosecurity. Adam's probably going to be leading most of this conversation because he has just done a webinar for us on avian flu. Being over in the UK, they're obviously experiencing this at the moment. Here in Australia, we haven't had any cases yet, but unfortunately, it is going to be coming. So we're going to be leaning heavily on his experiences to have a talk about what he's been through with avian flu and what we can learn from it in terms of protecting ourselves. So, Adam, what is biosecurity and why is it important?
Thanks, Sam. So biosecurity is defined upon a couple of different definitions depending on which reference you're utilizing. But the general covering is effectively putting measures in place to prevent the spread or minimize the risk of disease or outbreak. A lot of the biosecurity definitions, when you get into them, are actually largely around the poultry industry or the farming industry. Certainly here within the UK, DEFRA have some excellent definitions, and that's purely because they're assessing the impact to industry and then potentially the knock-on effects to our everyday human lives. So in the stricter sense, you are literally putting measures in place to stop anything bad from entering the practice within a clinical sense.
Okay. And I know that you could probably talk about this for hours, but could you give just a really quick rundown of the avian flu situation in the UK?
So the avian influenza situation within the UK has progressed largely within the last few years within a serious impact. Probably about 4 or so years ago, we started having the H5N1 strains, which are the ones currently classified as the largest risk to industry, wildlife, and potentially also zoonotic in their regard. We've traditionally had seasonal ups and downs, but recently we've literally been having a few months off over the dry summer months, and then it's coming back. However, now they're beginning to redefine that it's staying within the population of wild birds permanently year round, whereas effectively before it moved on with migration routes and such. So we've effectively got AI everywhere now, all year sort of thing. And certainly this year, we're seeing some cases within the poultry industry, wildlife cases and so forth being introduced after reporting. So yeah, it is evolving all the time.
And how has it affected you as a vet nurse working in an exotic only
Mm.
clinic?
Yeah, so certainly for our caseload, we are avian specialists, or our vets are avian residency trained. It has a big knock-on effect. So we have to do much more thorough health assessments of all birds entering the practice. We were rigorous anyway. However, we have had to increase our biosecurity in terms of assessing wildlife outside. Obviously, making assessments outside only limits our ability to then do treatment, diagnosis, and so forth. We've had to make some quite hard decisions as a hospital, and it's not one that anybody particularly likes, but obviously seeing an animal that potentially could be treated and perhaps having to opt for euthanasia over treatment because we have to protect our inpatient caseload and so forth is never an easy one. So for nursing, that brings its own challenges. The risk to obviously our own patients is well known, but also the risk to, or the potential for risk to staff and the spread within the localized area as well. We have to consider the financial impacts as well. There's a lot more PPE, there's a lot more stringent cleaning, there's a lot more focus upon meeting all of the biosecurity to the highest levels. We've had one incident probably 2, 3 years ago where a positive avian influenza case entered our building. That's not through lack of biosecurity measures. It was one species that didn't show the classic clinical signs, very hard to diagnose. It was winter, there was dark, there was all signs of a blockade, shall we say, with diagnosing before it entered the building. And then through that, we had to shut down our hospital for 2 to 3 days, which is very short period of time in comparison to what you read, but it's down to our strict cleaning protocols and biosecurity measures and ensuring the spread was minimized as much as possible that we're allowed to re-enter. But it is tough. It is tough. Once avian influenza of the highest range, H5N1 and so forth, are within the country, that's where the localized governments, councils and so forth take a very high interest, and they can put restriction zones in of movement and so forth, which means your patients may not even be able to travel to you or animals leaving that area in this stricter sense. So it is tough, especially for poultry owners and so forth.
Yeah, definitely sort of affects the welfare of them if they can't
Mm.
able to see you. That's a really heartbreaking situation. Now, you mentioned PPE. What PPE do you use to protect yourself from that? And is there a way that you can protect the animals that you're then going into work with inside your clinic?
So within my clinic, and I would hope for most clinics, we have different tier systems of biosecurity. Depending on your infectious case, so just stepping away from AI for a second, we operate on a color code system. So we operate on yellow, green, orange, and red. So yellow being the immunocompromised patients, so they may be patients under chemo treatment and so forth, or they might be unvaccinated animals with no known diseases, so they're at risk of catching something. Green is clean, basically. So green is where they've been tested, they're confirmed as safe of disease as far as we know. There's no risk to either the other animals or ourselves. Orange is where there's suspicion of having some disease, however, not suspected to be highly zoonotic. So, for example, rabbits with E. cunicula. And then red is the higher tier system where it's full barrier nurse and full PPE, either diseases that are potentially highly transferable to other patients of the same species, potentially animals of other species, or even people ourselves, so zoonotic in nature. So we have to tier them, which I think is key for biosecurity. And then that therefore dictates your level of PPE. So the classic apron, gloves, should always be utilized just for cleanliness generally. But that would be a suitable level for orange, whereas red would require full package gown, full length gown, full sleeve gowns, face mask, gloves, hat, foot baths, and so forth. However, if we're discussing AI, then that takes an even step further. You do need to be going down the suitably PPE-free, we call them over here, leveled face masks to prevent potential transmission for a patient to yourself, or failing that, then you need to wear double gloves, double gowns, double face masks, potentially a full bodysuit, which I know I sent Sam a picture of just to make her laugh because it's not the nicest looking get up, but wearing the full on biosecurity suit, but it is important not to take away from that. And then obviously all of that needs to be very carefully disposed of and put to one side. And then cleaning agent wise, we could also spend another hour on that because it's very dependent on licensing. So I know we've discussed this before, Sam, but here in the UK, Sage 4 is licensed for avian influenza, which means that we utilize it for most of our cleaning protocols. However, F10, which is a very popular thing utilized in zoos and everything, and we utilize it a lot, has not gone through the licensing process. So whilst we love F10 and we still utilize it for fogging because it does excellent for everything else, we have to also utilize the product that is good for avian influenza, known to break down the kind of obviously prevent virus and cleanliness and stuff. So we utilize two different cleaning protocols because Safe 10 is not safe for fogging, whereas F10 is safe for fogging. So we utilize both.
Yeah, that's where it comes into that you really need to be understanding what chemicals you have and what they are actually achieving and how to use them properly, including, contact time and those kinds of things.
Yes. Yeah.
When you mentioned that you've got different tiers for biosecurity, how do you define which animal goes into what tier? Not even just specifically avian influenza, just generally.
Yeah, so the tier system is more of a guide, shall we say. There's no one size fits all for every situation. However, I think when you're utilizing that kind of tier system, the best thing to remember is you can always downgrade a tier, but once you can never upgrade it. Once you've had an animal into an area, you've utilized a lower tier system to then try and upgrade your biosecurity level. The horse is already bolted, as it were. You can't prevent the spread of disease, your contact places, the patient interaction, the knowing where the potential disease is transferred to and what area as an animal is entered. So you could try and minimize as much as you can, but it's already out there. And the best prevention of disease spread is literally taking the steps to prevent it physically being able to be transferred. So by starting off at, say, a red tier if you're unsure, and then when you're a bit more sure, you can downgrade to an orange. And then when it's all clear from testing, then you can downgrade to a green. Yes, it may waste more consumables. It may be more time consuming, especially from a cleaning perspective and obviously putting on the PPE and taking it off and so forth. But it does prevent long-term risk, or rather minimizes longer-term risk of disease spread within your clinic. And so, yeah, I always fundamentally believe downgrading a biosecurity level is better than trying to upgrade it because the horse is already bolted for sure.
Definitely. just with my zoo background, they're very, very on to biosecurity. If a new animal comes in from another facility, we don't want to then introduce it into our facility and potentially have infectious diseases be passed through. So they're put through varying periods of quarantine and testing before they're then merged in with the other zoo animals. But most zoo clinics, also zoo hospitals, have wildlife that come in that they treat, and they're treated very much as if they are infectious. So they are treated very separately and they never come into contact with the zoo animal. And we actually allocate nurses who are just on wildlife that day and won't handle any of the zoo animals. And we have full PPE, and we take even our uniform off at the end of the day to wash. There, we take our boots off and we leave them at work. So most of the time we just walk out of there in our normal clothes. So it's a huge, huge thing in the zoo industry as well.
And I think that's a really important thing to highlight just at the end there. Not only obviously splitting a staff, but also having the work specific based shoes that are only within the building and shoes that are wipeable and cleanable, and then leaving your uniform behind to be cleaned at the end of the day. That automatically is an excellent biosecurity measure, because you don't want to be taking your uniform home to wash at home within your car and so forth. The risk of fomites and so forth increases exponentially. So yeah, just changing, like you said, is a massive first step. So if people aren't doing within that clinic, we do within ours, like, and obviously you do within the zoo background, I think that's an excellent first step, that people thinking, how can I improve? Straight away, just do something as simple as that. And there's a big difference.
Yep. And you don't have to pay for your own laundry anymore.
And you don't have to pay for your own laundry, which is even better.
Do you ever in the exotic pet industry have to worry about anthracnoses, so diseases or conditions that we can pass to animals? So when again working with zoo animals, there was a lot of conditions that we could pass on to them. So the primates, we couldn't work if we had a cough or a cold, because something that's simple for us could be lethal to them. Do you think that there's any like that in the exotic pet world, or is it just strictly?
Yeah. No, absolutely. Yeah, no, definitely. I think there is definitely those kind of diseases. I mean, my work is a strange one, because we obviously are exotic, but we do have some zoo caseload and wildlife caseloads and so forth. So you do see a bit of everything. So obviously, like you touched on, the common cold, and we have to be careful of as well for our primates. But also we have to be careful not to transfer to, say, something like ferrets. So they're very susceptible to coronavirus. They have their own COVID strains within ferrets, but they can also catch the very famous now COVID-19 from us up. So we have to be very mindful of that. Reptiles always get a bad rep for having salmonella or pinworm and so forth. But by the same token, somebody with kids who has a pinworm infection could potentially, and I've seen it within owners, could potentially then pass it to the reptile. So the reptile can get the blame, but actually it's the kids going to school, picking up the pinworm and then transferring it to the animal. So yeah, we do absolutely have to be careful. Obviously, the levels of risks differ depending on species, but ultimately, as much as we like to sometimes think we're not, like humans are part of the animal family, we might think we're all above and beyond that sort of thing, but a lot of the diseases that have evolved to infect different mammals can infect us and vice versa. So I think we always have to be mindful through proper hygiene and appropriate biosecurity that we're not giving anything back to the animals that we're physically trying to treat, because that would just be hypocritical, basically, if we're infecting all this stuff when they come in for treatment.
Yeah.
The irony of trying to treat an animal that's then called something isn't, it should never be lost in us. So yeah, absolutely we can, but it depends on the species, as you say. Primates and stuff are obviously going to be higher risk to us because they're more close lineage, but even down to the little tortoise that's got a pinworm infection out of nowhere, but we can absolutely pass that to them as well.
Yeah. One of my big pet peeves is seeing reptiles being kissed by their owners. You just think, what are you catching or what are you giving? It's
absolutely. Yeah, we've had a few owners, bless them, and I understand why it's hard not to, but they've mouth fed their pet parrots and so forth. But not for me. But then we've all seen, people with dogs letting them lick their face, and even if they don't lick your face, they lick your hand, and then you don't wash your hand, and then you touch your face yourself. You can very quickly see why disease and different infections can spread very quickly.
Definitely. Have you come across any obstacles when you were trying to implement PPE and biosecurity with your team, or is your team sort of understanding of why it's needed?
Yeah, I think my team, and it is not to give them big heads or anything, because I know some of them are listening to this, but I think my team are generally very good. We're all human, and I think that's important to remember when we're discussing this topic. We're all human, so every individual at times can have an off day or make a mistake or, just get things slightly wrong in hindsight that they would have done differently. But my team are very open to it. Exotics, by its very nature, just because of the amount of species that we see, we have a higher potential risk of something zoonotic being passed. And I think everybody being aware of that from day one definitely helps. I think it's important when you're implementing these kind of changes as well to have that conversation with the team. You as a manager or, as a senior nurse or whatever it may be, or senior vet, obviously, whatever it may be, will obviously have an idea in your head of what you need to achieve. But sometimes achieving it may look a little bit different in reality to what you have in your mind. So you might say, well, you know what, we need to do this. But by involving different members of the team, everybody can have the opportunity to voice their opinions, give some feedback on whether or not they think certain steps will work and everything. And certainly within my guys, quite regularly, they put in new ideas and do tweak protocols. We are limited by licensing and the sourceability of PPE, but certainly with regards to how we're doing things, the number of people interacting with certain cases, different levels and everything. Yeah, I think open conversation is the way forward, to be honest. It makes people feel involved and not just being told what to do, but just understand a bit about the reasons behind it. And I think it's really important within junior staff in that regard as well. Obviously, senior, sometimes we think, we've seen it, we've done it, we know better than them, but junior team members and any team member can have a different perspective of things. And sometimes they can just make you suddenly go, that is a good idea. Let's try it this way next time and go from there. So yeah, I find it very good at my place, but we have quite an open feedback work-based style of working, which sometimes is great and sometimes, brings its own frustrations at times, but generally it's great for this kind of thing.
Yeah, of course you had to talk up your own team though, if you're at the head nurse.
I know. Well, I know they're listening, so it's also have to be like, you guys are great. No, they're very, very good at this. And yeah, but we also know we have to be, because we have been it through it once, where when we've seen it happen, we know how bad it can be. And obviously nobody wants to go that deep cleaning and the 5 a.m. starts and the Vercon and everything else. It is logistically a bit difficult and a bit of a nightmare. So nobody wants to do that. So, and then nobody wants to have an infectious animal on site, potentially risking the other inpatients. Worst case, when we're talking about AI, you are talking about potentially the culling of an entire collection with an AI positive, or potentially all the inpatients at hospital. And I think it's important to bear that in mind, the worst case scenario. And then you won't hopefully get to that point by remembering the worst case scenario is very serious.
Yeah, it's very big consequences for it's not doing the right thing. Now, can I just mention that last week, I know we talked about managers versus leaders. I just have to say, you sound like an amazing leader, involving your team and your juniors.
No, it's very kind. And I know, Sam, obviously you've done a lot of it as well. And I think this whole topic and generally, like we touched on last week, the best way people learn is for them to understand why you're doing something the way you're doing it.
Yes.
And even if they're junior but don't feel like they've got quite the confidence yet to have an opinion, that's fine. But involving them and giving them the opportunity, I think it just, for me, makes common sense.
So I know that we've been talking a lot about birds, but we're also going to be talking about rabbits later with Argus speaker. I was wondering about reptiles. Is there anything that we need to be concerned about with biosecurity with them?
Yeah, I think it's a really good point. And I also think reptiles, just before I get into it, are often forgotten ones. Like a lot of people keep reptiles, they normally have like 1 or 2, and then they die and you don't really see them in clinic. But I think infectious diseases are probably, certainly in the UK, a bit more prevalent than perhaps we initially think. So you've got the classic ones that everybody's always super scared of, salmonella, pinworm, like I've already touched on and so forth. But then you've still got the more serious ones. So you've got the ones like the paramyxoviruses, which I found out you guys called the sunshine virus, which is really infectious, really contagious, really affects the respiratory system. Then you get kind of other ones, so you get encephalitis, adenoviruses, which affect the immune system. So I think reptiles often get a bad rep of being seen as old school, hardy animals that don't get anything, whereas in reality, I think they do. I think it's just we don't necessarily pick up on them, or owners may not present them until they're already deceased, unfortunately. And certainly in the UK, we see a lot of hibernating tortoises, which I'm guessing you guys probably don't quite as much, no. But we see a lot, and they tend to have a lot of respiratory signs, and something can lay dormant for a while. and then it may present itself when they've got something else going on that puts them at a reduced immune system, and then suddenly this other virus that has been latent is suddenly taken over. So yeah, we see a lot in reptiles, certainly more than most people would automatically think in the pet trade, simply because reptiles, like I say, are often forgotten as being potentially infectious.
And I find that in exotic clinics here, they're the smallest percentage of patients. It's usually birds and rabbits. But when we do get them in, it's really important that we are practicing a bit of barrier nursing, biosecurity, because they can carry significant viruses that can spread to other patients. I've had some present with the sunshine virus and it's wiped out their whole collection of 30 reptiles. So in those kinds of cases, when I know someone has reptiles at home and they're bringing one into their collection, I say that you need to be really onto it with quarantining and barrier nursing, because if you just put them into your collection or even in their separate enclosure, which I hope you would, if you then use the same tongs or the same bedding into the next one, you're just going to be spreading some infection that way. So in zoos, the practice for quarantining is between 3 to 6 months, which is a very long time compared to, say, a mammal. So a mammal would be about 30 days. But the fact that reptiles can test negative but still have that condition, 6 months is sort of the minimum you need to be quarantining these guys for. So that's also going with adding new chickens to your flock or a new rabbit. Quarantine is super important part of biosecurity.
Absolutely. And like you touched on as well, so the only other thing I think we should add is obviously there is a lot of testing out there, and people, if your dog or cat was sick, you wouldn't necessarily think twice about getting a blood test. And yet for some owners, for whatever reason, they go, is it really needed in an exotic? And the answer probably is yeah, even if it shows it's fine. Like you said, it's not 100% foolproof to show disease every time. But if some of the blood values come back and they're not quite right, and then you can begin to think, okay, so, this bird, for instance, has got a higher white blood cell. What could it then mean? Do we need further testing? And I think encouraging owners, or having the confidence to encourage owners to think, if you would do this for your dog or cat, why wouldn't you do this for your parrot or your tortoise or your rabbit or whatever it may be? And I think that's a really important step, that these animals should receive the same level of treatment and care that anything else should. So if we're thinking we would normally offer that for dog or cat, we should probably be considering offering it for the exotics as well, because you never know what you might find.
Exactly. Respect for every single animal that's in front of you.
Absolutely.
So tonight's guest speaker here is Alana. So Alana is from the Rabbit Doctors in Melbourne. I've had the pleasure of seeing her in action, and she looks like an amazing leader and nurse. I stayed around for one of their nurse meetings and I was really impressed with the team building. So now we're talking about biosecurity tonight. You obviously work with rabbits at the moment. What does biosecurity mean to you?
Yeah, thanks for the compliment, by the way. Yeah. We have a few contagious diseases we get a bit worried about with bunnies, calicivirus and myxomatosis. Even though we're in around the city, we do absolutely see like some pretty seasonal, pretty typical weather pattern where we'll suddenly see flare-ups of suspected cases. We actually developed a triage policy that means that basically any emergency is actually isolated and triaged in full PPE until proven otherwise. And we've got a few essentially like over the phone red flags, particularly for our reception team. That would be, it has swollen eyes, which we might start off with a photo through the email first to if we think it may be myxomatosis, in which case we then do a car park, assist the client coming out to the car and doing a consultation that way, which ultimately ends in euthanasia for these guys.
I know that someone who hasn't worked with rabbits before may feel that that is quite extreme, doing PPE and isolation, but having myself work with them, that is such an excellent thing to hear that you do, because it is so infectious. Yeah, it's not a nice thing to have to deal with.
Yeah, I always like to compare it, particularly for new nurses coming in who haven't experienced that before, is compared to parvovirus. And often I think people can smell the parvovirus. So it's kind of, I'm always like, you can't smell the calicivirus or the myxomatosis, but think of it like treat it the same way.
Yeah. Do you sort of do the same thing with rabbits, Adam?
Yeah, absolutely. Yeah, we follow a very similar setup. And to a certain extent, once you start to think of the car park as an extension of your practice, you don't feel so bad for it. As long as you explain to your owners the reason why and so forth, I think it's a very useful tool to stop the potential spread of anything infectious entering the hospital. And certainly, Alanna's made a great point there about thinking about it from a parvovirus perspective. For anybody that's not an exotics and then thinking, oh, biosecurity, it's all big and scary and exotics. Just think about what you do now in dog and cat, and obviously parvo is a classic one, and cat feel for the cats. And then once you start to think about the steps you take with those, the rabbits, the birds, the reptiles, whatever it may be, suddenly begin to make a lot more sense. It's a really good point to review.
So, Alanna, you are actually going to be presenting at our conference this year, the 2025 Exotic Vet Nurse Training Conference. You're going to be talking on triage of rabbits, the rabbit duck delay. Can you tell us, firstly, a little bit about yourself and how you got to your position, and then give us a bit of a rundown on what your presentation is going to be about?
So I came from country Victoria doing all the after hours, and I can remember doing like a goat cesarean at 3 a.m. in the morning and being like, this is so cool. I want to do this all the time. And so then I moved to Melbourne and did emergency and critical care, which was awesome. Then life happens, 5 years in split shifts. The night shift is pretty tough on the body. So I was like, oh, I'll give something else a go. And I've always had a real interest in exotics. It's just not where I sort of ended up when I moved to Melbourne. I happened to be in the right place at the right time. And so I started working in the rabbit doctors. I did have to bully Dr. Jerry into hiring me. I regret it now. But what I noticed really quickly is our caseload grew. We just went through growth and coming into more of a GP setting. Vets are amazing, but we all have our different specialties that we're really amazing at and our different priorities. And we were having a lot of emergencies present. And I'm one of those nurses that can see the germs. So I'm that person who's going around with a broom and a mop after something like potentially contagious has been in the space. So watching someone under the pump, they've just seen a patient and then they've grabbed an otoscope, they haven't washed it or cleaned it, and they walk over to the next patient. And I'm like, yep. So that's kind of where it was, people just needed structure. And so I worked with the team to develop a really efficient and effective way to triage all our patients. I think last time I timed it, someone triaged a rabbit, including drawing bloods, in 7 minutes. Wow. And, 10 minutes with the client, and that's not even 10 minutes, sometimes if you're depending on the nurse and the client to get that verbal history. And that's a pretty efficient way to get that patient in pretty quickly for whatever it needs. And that definitely improved our process. It also reduced our team's stress as well, because there was that solid structure in place and they had the same experience every time as well.
So walk us through different tiers of urgency. So Adam was talking about different tiers of, infectious risk. But when you're talking about triage, how do you kind of classify who gets seen now or in a minute or probably can wait for a bit later in the day?
We actually developed, which I will share at the conference, a really cool visual chart. So level 1 urgency being like ASAP as soon as we can. Level 2, it's urgent, but maybe it can wait an hour. Level 3 of it's stable, things could change, let's get it seen in the next few hours. Level 4, stable, it's going to wait. And level 5 being dead on arrival is a general rule. So each of them have sort of signs or symptoms within them, and how we utilize that chart is you will level up. If in doubt, level up. It's always better too. And so some of the key criteria on like our level 1 urgency is it's actively bleeding everywhere and you can't stop that with a pressure bandage. Temperature of over 40 degrees, blood glucose that is too low to read, a blood glucose that is over 20, something that's cyanotic, something having respiratory issues, those all sort of land into that level 1 urgency. We need to stop what we're doing and actually help this patient. This is life or death. Level 2 can sometimes be, maybe a fracture, but the patient is able to sit comfortably. It can have pain relief and maybe wait half an hour to an hour to then have a full assessment. What else is in that level 2? It's it's a flow chart of, I do still have people checking in with me, which is amazing because you have to take in the whole picture, right? You go through a TPR, you do the bloods, but sometimes your spidey senses, you look at it and you're like, there's just something not quite right here. And you've got to trust that gut instinct. And sometimes it's the verbal history from the client being like, well, he has been living outside and he does like to kiss the wild rabbit that's outside. And you've got a calicivirus that's got a chest full of fluid or something like that. So, yeah.
Yeah. people are triaging from, say, a general practice clinic. Someone's called up and said, my male cat is constipated. He's a bit stressed. That's kind of a warning sign that maybe he needs to come in because he may be urinary blocked. Is there sort of some of those trick things that can happen with rabbits that people should be aware of?
Yep. I think sometimes people get a little afraid of bunnies because they are different, and they totally are. But I think you actually have the spidey senses, but you already have all the skills in place to actually do something for that patient. And sometimes it just means taking a deep breath, slowing down and looking at it. What do you know about this? It's a prey species. Okay, so I can't be bold and go up to it like I could a cat or a dog to start engaging with it. It's not maybe going to give me as much information. But you can do the full health check. You can do the top to tail. You can help your vet do that as well, because sometimes vets are very scared of these guys and they don't need to be. I guess the phone calls that we screen for assistance is people have maybe they've had the client call and say he's not eating, and someone goes, oh my God, it's gut stasis. And they haven't even physically examined the rabbit yet. Yeah. So where we provide the most support is like, do that full top to tail TPR. What can you see? Is there anything obvious for why this guy might be unwell? Is there a leg hanging off in the wrong direction? Is there bleeding? Is it straining to urinate? Is it vocalizing? Is it teeth grinding? You've got this, you can see he's hunched. It's similar grimace in the way that you would look at a cat and go, that cat's painful. Like, he just looks really sad. You can totally pick up on those things. The other two really amazing tools that we get people to screen with is a PCV, TP, and blood glucose, because that can give us so much information. And even if we're providing some phone assistance for like what to do next, even if that's just something like pain relief, never underestimate pain relief. That can be really helpful for us to give that information as well.
Yeah, definitely.
Yeah, absolutely. And when you're doing those things from a prey species perspective, as you well know, Alana, it could lead to potential things like gut stasis and stuff. So your presenting thing might obviously be something gut stasis, but gut stasis is not a disease. Gut stasis is a symptom. And I think people in clinic just being aware, oh, the rabbit's pooing and now it starts pooing again. For some reason, it wasn't pooing in the first place. So you still need to delve that little bit underneath the surface to figure out exactly what's causing that, whether it's infectious or dental or whatever it may be.
Absolutely.
So, Alana, can you give us a bit of an idea? We all work in exotic zoo specialism stuff, but we appreciate rabbits are very popular animals, and they're very popular in the UK. From what I've gathered, they're very popular in Australia as well. Can you give us some very simple steps that if you do have a suspicious case, but you might not have, that dedicated isolation ward, is there any pieces of generalized equipment or measures that you could put in for somebody to kind of take those steps themselves while they are doing some of the other background checks?
So we actually used to work within an emergency centre. So while our clinic primarily saw bunnies, there'd be the occasional one overnight, and their priority wasn't getting into full PPE for something like calicivirus. So just like a common, wash your hands between patients, wash your equipment between patients, wipe your bench between patients. The stuff that we do every day, I say with a giggle. But in all seriousness, general hygiene is tremendously helpful. We actually used to because we did see a few patients in the overnight ICU, we used to be over cautious and we'd leave F10 to soak in a cage, but we'd leave a little notification up and we'd say no rabbits for 48 hours. And that was definitely overkill, because we know when we're using proper concentrations of our disinfectants that it does what it needs to. This always makes me giggle when I see someone panic and I see them spraying their claws with F10. Like, come on, they're on the watch. Get changed if you need to. I suppose a fun fact to pop in there is maybe nurses in GP that are faced with something and they're not sure if it's contagious and they maybe have bunnies at home. Again, like general hygiene, washing your hands, strip off as soon as you get home, pop those clothes in a hot wash, have a shower and get changed immediately before going into your pet to keep them safe is probably a really good one as well. Never underestimate gloves and puppy pads, disposable.
Yeah, really useful. And again, I think it comes back to people in dog and cat practice just taking a breath, basically. Take a breath, consider what it potentially might have, and don't overthink it. Rabbits are scary, as you said earlier, but they are also super common. So whether you're lucky or not, you're probably going to see a rabbit.
Yeah.
And obviously just having that know-how to be like, what would I do if it was parvo, like you said, or what would I do? Just follow a similar process, and you can't go wrong.
What's the saying? Prepare for the worst and deal with it when it happens. It's not quite it.
Hope for the best, prepare for the worst.
There you go.
I think I like yours better.
Just prepare for the worst, and then prepare for the worst, and that'll do.
questions I want to ask everyone that comes on. First off, how do you practice self-care? And given that you're a nursing manager, how do you practice self-care for your team?
For the team is probably a little different to how I personally do it. For the team, I'm always poking them. When's your holiday booked? When was your last holiday? You look crusty. Why are you tired? There's a lot of love. Sometimes people maybe don't have the biggest support network at home, so it's checking in with the guys to make sure they're actually looking after themselves. Sometimes they're not. Sometimes that means, maybe they need an extra day off here or there to just try and recover themselves. I invest in every single mindful webinar that comes out because, there might be a new tool or resource that works for someone. Journaling doesn't work for everyone. I myself like being outdoors, and I'm currently obsessed with chickens, and I hatched chickens. So my entire life is about chickens at the moment. They're the greatest things ever. And I like gardening. So I sort of like being outdoors. That's my go-to reset for looking at that.
Yeah, no, it's good. Now, everyone that I've asked this second question has answered the exact same way. So I'll be really interested to see what you say. What is your dream animal to work with?
We do animal we work with. Rabbits are pretty great. They they rarely bite. They don't smell. You can put a catheter in by yourself. Like, how great is that? You don't hurt your back.
Yeah, they're pretty cool.
It's pretty nice. Yeah. Rabbits are actually pretty wonderful to treat. I go past a dog now that even has bad breath, and I'm like, look.
Yeah.
So offended by it.
No, every single person we've asked has said a form of dinosaur. So,
same. That's kind of scary. That's like an angry cat. That's like the angriest cat you've ever met.
All right, well, you might leave it there. Just a reminder that Alana is presenting her talk at the conference on rabbit triage. So tickets are still available if you wanted to head to our website, www.exoticvetnursetraining.com, and register. There's still early bird tickets available depending on when you're listening to this podcast. But thank you so much for joining us. That was really, really fun having you on.
No worries. Thanks for having me.
And that brings us to the end of episode 2 of Exotic Ward Conversations. Next week, we're going to be talking about something a little bit heavier, but super important, mental health. It's being brought up and asked that we talk about it by a few different nurses. So we're going to be talking about that. And just to keep it light at the end, we're also going to be talking about frogs. So thank you for listening. I really appreciate it. And if you haven't heard our first episode, go back and have a listen. And a huge thank you to you, Adam, for co-hosting this terrifying journey of ours. I have had a lot of fun, as I've mentioned to you through this. We're probably going to cut out those parts where we're laughing, but I have had a great time with you. So yeah, thank you so much.
No worries. Thank you very much, Sam, and thank you very much for listening. Like we said last time, we genuinely hope you guys are finding this useful. And if you're not, please let us know as well, positive or negatively, because we might stop. But no, we're genuinely enjoying you guys listening to us. As last time, if you've got any ideas, any topics, anything whatsoever, let us know, because we want to know what you guys would like us to talk about and discuss, and hopefully learn something along the way as well.